A very good afternoon, everyone. On behalf of Dr. KK's Heart Care Foundation of India, I welcome you to our 70th weekly webinar. I would like to extend a very warm welcome to our co-hosts for today who have continued to support Dr. KK Agarwal's vision and mission to impart medical education and healthcare education to as many people as possible. So thank you so much to all our co-hosts, to everyone who's joined us today, to our speaker, to our audience. Thank you. You're really helping us take forward our work, and we really appreciate your support. I would like to extend a very warm welcome to our co-host for today, Mrs. Marilyn Flincy, Principal, Apollo School of Nursing, Indraprastha College, Apollo Hospital, Ms. Ayushi Bansal, Professor, LLRM Medical College, Meerut, and Mrs. Madhumita Toshin, Assistant Professor, Rabindranath Tagore University, Institute of Nursing, Bhopal, Madhya Pradesh. I would now invite Marilyn ma'am to really say a few words and introduce the session.
Namaste, a warm good morning to one and all present here. I bring warm greetings to you all from Indraprastha Apollo Hospital, New Delhi, and Apollo Group of Hospitals. I highly appreciate the initiative by Heart Care Foundation of India for conducting this weekly webinar to enlighten the knowledge and awareness of the nursing fraternity, both the student nurses and other nursing professionals. I take this opportunity to give a brief about the speaker. With immense pleasure, I welcome the speaker for today's webinar, Dr. Sanjay Bajpai, the clinical head of Northern East Portia Medical. Sir has over 15 years of experience in critical care and emergency medicine and home health care. Before joining Portia, he was associated with Philips Home Care for over 18 months as clinical head in Delhi NCR. He was associated with tertiary care hospitals like Saptajing, Sir Gangaram Hospital, and Artemis. He has a vast experience in air and road transport of critically ill patients. Dr. Sanjay is a certified QAI assessor for home health care and certified clinical diabetologies and adult life support. We welcome you, sir. It is a great honor to have you amongst us as a speaker. We welcome you. Next, I want to welcome our moderator for today's session, Ms. Naina Agarwal Ahuja, a dynamic personality who is the trustee of Dr. KK's Heart Care Foundation of India. She is the founder of Talking Point Communication, which is a leading integration PR and communication agency in India, servicing clients across the domains of startups, healthcare technology, FMCG education, social and lifestyle and entertainment. We welcome you, Ms. Naina. Thank you. And I wish happy learning to each and every one of the participants who has joined here. Once again, I extend my gratitude to Heart Care Foundation of India for providing us this learning platform. Thank you, one and all.
Thank you so much, ma'am. Thank you for joining us. Can I have Ms. Ayushi Bansal, please? Professor, LLRM Medical College. Welcome, ma'am.
Yes, good afternoon. And thank you, Mrs. D. Marilyn Flincy, ma'am. I would like to thank Dr. KK Heart Care Foundation of India for giving me opportunity to share my views on the topic out of hospital management of COVID-19. First, I would like to thank Ms. Naina Agarwal for introducing me and Mrs. D. Marilyn from Apollo Hospital and Apollo College. Thank you so much. As we all know, the third wave of COVID-19 is almost commenced in India. We all are the citizens of India having the responsibility, we including the health professionals as well as common layperson have the same responsibility to adapt COVID appropriate behavior or COVID protocols, because India has such a huge number of population that no doubtly has the best medicine and health facilities over here for the people, but may not be able to accommodate a huge number of patients coming with COVID-19 infection on daily basis. In this regard, we all must know how to manage COVID-19 at home or in ambulatory care. Approximately 80% of patients with COVID-19 have mild illness that does not require any medical attention or instrumentation or hospitalization. Most patients with mild COVID-19, like absence of viral pneumonia and hypoxemia, can be managed in ambulatory care settings or at home very well. First, we have to watch the symptoms and then to provide supportive and symptomatic care to the patient and take the steps to reduce the risk of disease transmission. And we all know the steps, like we all know the COVID protocols: self-isolation, wear mask, and hand washing, social distancing. These are the protocols and these are the steps to reduce the risk of higher transmission of diseases. Patients with symptoms of COVID-19 should be triaged via telehealth, telecommunication, or telehealth visits to determine whether they require COVID-19 specific therapy or in-person care. Ventilated room or place is always a necessary need for COVID-19 patients. And if the patient feel dyspnea or suffocation, then we must have to monitor his or her saturation, oxygen saturation. It should not be below 94%, and check or his or her vital signs regularly is a very must. In most patients, dyspnea tends to occur between 4 and 8 days after most of the onset of symptoms, but it can also occur after 10 days. While mild dyspnea, we can say, is normal, but worsening dyspnea and severe chest pain, tightness suggest the development or progression of pulmonary involvement, that is lung involvement. It should be followed closely with telehealth or in-person monitoring, particularly during the few days. Sometimes many people complain that they got different results from every finger when they assess the pulse oximeter. Patients should be advised to use pulse oximeter in warm finger. In our hand, warm finger should be admitted rather than cold fingers for better assessment of saturation. Sometimes institutional resources are scarce that it may be necessary to discharge stable patients and to provide an advanced level of home care, including supplemental oxygen and pulse oximetry, as well as close follow-up. All these patients and their family members or caregivers should be counseled about the warning symptoms like unmanageable dyspnea, dizziness, mental status changes, confusion, etc. Patients should be educated about the time-bound course of the symptoms and the possible respiratory decline that may occur on average 1 week after the onset of illness. Many people used to be in dilemma about how to care pregnant ladies and children with COVID-19 at home. So I must say, managing pregnant outpatients with COVID-19 is similar to managing non-pregnant cases or patients. In pregnant patients, SpO2 must be maintained at 95% or above. Therefore, the threshold for monitoring pregnant patient is is somehow low. The monitoring strategy should be discussed on cases basis with the obstetrician. Children with risk factors with multi-system inflammatory syndromes may require hospitalization sometimes for more intensive monitoring. But most children with mild or moderate COVID-19 illness will not progress to have more severe illness and will recover without specific therapy. That's all by my side. Thanks for your patient learning. And hand over to you, Mrs. Madhumita Toshin, ma'am.
Good afternoon to everyone. I am Madhumita Toshin from Rabindranath Tagore University, Bhopal. I would like to thank to Nana ma'am that she introduced me, and Dr. Marlene ma'am from Apollo. She nicely gave the description of everyone, and I am very much thankful that I have joined this Dr. KK Agarwal Foundation, and happy to know this that we are again that as third wave has come, so we are going to talk on that. So thank you everyone, and
all the members.
Thank you so much, ma'am. Thank you for joining us. Thank you to all the wonderful co-hosts. We truly appreciate your time. The topic for today is home management of COVID-19, and that's a very, very important sort of topic. And hence, we decided to get Dr. Sanjay, who is an expert in this field, and he's been, involved in it for many years. So thought, he may be able to add value here. Dr. Sanjay, thank you for taking out time and joining us. Would you want to maybe start by giving your sort of experience in the current wave? What has been the benefit since the past 2 years on home management of COVID-19? And also we have, of course, students here, experts from the nursing community. So if you could share all your key takeaways for them. Over to you, sir.
Thank you so much, Nana, for bringing me here and introduced me for such a beautiful fraternity over here. It's always been a pleasure talking to the people from medical backgrounds on any new initiative that is happening around or any discussion which involves students into that. It's always a pleasure to speaking to them, taking their inputs in and knowing each other very well, how we can make the medical services better and better on daily basis. What are the things that we need to take care and how we are going to cope up with the situation that is a worldwide issue nowadays, and everybody in some manner is being affected with all these things. As we know, we are under the threat of the third wave of the COVID nowadays. Every day we must be hearing there are increase in the number. Every city, every village, and every state is been under the impression of this COVID third wave. So, as one of the speakers said, ki one this is basically a problem which is having, which is affecting all age group, all around the population, and everybody in some manner is being affected by this issue every now and then. What are the things that we need to take care, how we have the situation, and how effectively we can manage within ourselves while staying at home? These are the few important things that everyone here should know, because speaker said out of 70-80% of the COVID positive patient doesn't even require hospitalization. If they can take care uh, their own medical health in a right manner as per the directions of the WHO, the Ministry of India, and the guidance of their doctor, if they have been spoken to any of them, things can be managed easily at the home. But one has to be very, very vigilant, very, very specific about the things happening around their health and how it is affecting to the other family members that also need to be taken care. But yes, things can be managed. It doesn't require any panic stage to be created. And every time it is not necessary to rush to the hospital. You can simply go through a few basic tests. You can also get to know what exactly is the status, if it is positive or negative. And God forbid, if it is positive, how to take care of the things while staying at home without affecting any of your other family members and the other society members also. So I would like to take up any questions, any inputs from all of you. If you want to discuss anything from my end, if I can help anybody to how to deal with this situation, what are the things that need to be taken care, and how we can make ourselves healthy in this current scenario. That is, we all are here to discuss and share inputs about.
So one, I would request everyone, whoever has questions, either raise your hands or put it in the chat box. Till then, I've also got a list of questions for you, Dr. Sanjay. Of course, I understand Potia is a leader in the home healthcare segment and out of hospital care segment. So you would have enough and more experience. Like you mentioned, a lot of cases can be handled out of the hospital. So how do you differentiate which are the cases now that there are even ICU at home setups available and critical care patients can be handled? So can you give us a little bit of insight into the scope of how can we reduce the burden on hospitals? We saw during the Delta wave that there were no hospital beds available, right? Even for very, very critical patients who need to be in the hospital scenario. So how can the nursing community also kind of help identify the difference in the patients that need to be clinically treated within the hospital setup, who are fit to be who are the patients who are usually treated at the home level? How has this changed during the COVID pandemic, given that telemedicine, home care has become more mainstream than it was earlier? And what are the opportunities and also challenges that we face dealing with patients at home or in hospital?
So basically, if we talk about home healthcare and especially in the segment of this COVID, so it has a huge success, this home isolation program, which has been done all through the world. Government has set certain norms for the potential patients, those who can be managed easily. There is a certain criteria upon which a patient can be identified, whether they are really a fit or a potential patient to be at home and can be managed within the home proximity. So, especially if you look into the younger population, and to be very specific, if a population of from 15 years to 65 years of age, these are the patients, if they have any mild to moderate kind or asymptomatic kind of COVID positive status, there is no need to rush into the hospital on a very panic mode. Definitely things can be evaluated on preliminary basis within the home proximity. They can go through the test, they can know the status, whether it is positive or negative, and basis their own, they can evaluate themselves, yes, whether they fits into the criteria of home isolation, or if there is anything which can be done only in the hospital scenario. So if we look into the home healthcare scenario, the criteria says yes, a population which is between 15 to 65 years of age, if they have a mild grade of fever, approximately 100, not more than that. If their oxygen saturations are okay and they doesn't require any breathing, there is no signs of any breathing difficulty, or they are not having any respiratory distress, if we say in a medical terminology. So for that, they have to regularly monitor their oxygen saturation and maintain their
Sapna, did Dr. Sanjay get dropped? 1 second. Is it my connection or Dr. Sanjay? Can you hear us?
Yes, I can hear. Sorry about the network. It's sometime in and out of the
Yeah.
discussion.
Yeah.
So, I was talking about the oxygen saturation. So one has to monitor their oxygen saturation regularly with the help of pulse oximeter. So with the help of pulse oximeter, they can easily measure their oxygen saturation. And if their oxygen saturation on room air is above 93, 94, there is nothing to panic about. Yes, every individual has certain different levels. Some may have 100% of oxygen saturation. Some may have 94, 95, 96 as their normal saturation. That doesn't require any additional oxygen support during the course of the illness. But yes, if they're having a fullness of breath, if they're feeling, yes, there is some difficulty in breathing and they are not maintaining saturation above 93 in the room air, definitely they need a further evaluation on pulmonary aspect, so that things can be evaluated whether the COVID has impacted their lungs, their respiratory system, or there may be a requirement of some advanced care which cannot be done in a home setup. But yes, if the criteria is okay and they are maintaining all their vitals, their saturation within the normal limit, they do not have any mental confusion, they do not have any symptoms which cannot be managed by themselves or by a caregiver at their home, definitely they can reach out to the hospital for the advanced care. But till the time there are things which are easily manageable, we should not rush to the hospital, because what happens whenever there is a panic mode in the society, everybody feels like they should be given a preference. And during that phase, we sometimes, as a doctor, might miss a very potential patient, those who require hospital care. And yes, if the things are easily manageable, definitely they do require some kind of counseling so that they themselves feel confident that they can be managed at home. Their family should feel like, yes, their patient, their family members are going in the right direction of the medical management. And yes, once they start over the period of next 3 4 days of intense monitoring, they definitely start recovering, and they feel like, yes, that was a right decision not to go to the hospital, because if they land up to the hospital, there may be a different kind of patient. There is always a possibility of cross infection from one patient to another patient. And once the hospitals are too much occupied with a similar kind of disease, there is always a huge potential or huge possibility that patient which is being admitted with a certain medical disease has caught up some other medical issues. So this cross infection is one of the major concern which always happens in the hospital, and especially for the disease which is very common in transmission. Even a sneezing, coughing, even a sharing common things within the patient. If a thermometer which is being used to a patient and applied to another patient, that can also transmit the disease from one patient to another patient. So to deal with all these possible things, there is a which almost all of you must be knowing very well throughout these days. The patient needs some kind of isolation, means they have to be in a separate room. They have to have their own personal belongings within the rooms, their all clothing, their food, their utensils, they all has to be kept separate so that they can be isolated from the patient who is being admitted to the hospital. And so creating a isolated atmosphere always means to stop the transmission of the disease. As we know, COVID virus spreads very rapidly and very fast within the society, within the family member. Hence, it is always been advised a patient has to be kept isolated for a number of days till the time till the things streamline. And once, yes, as per the nature of the illness, as per the medical condition of the patient, once they are stabilized, they can be kept out of that isolation room or isolation period.
So, Dr. Sanjay, my question is, how can the nursing community really help with the burden on the healthcare system? We saw a lot of home care nursing attendants, nurses being deployed in the home care setting as well for complex patients. Also, a lot of people have the fear, right? So, again, I'm talking as a completely non-medical person. I may have the fear if someone contracts COVID, if it's a pregnant woman, or if it's someone who has diabetes or is has comorbid conditions or heart disease. It may be someone who's above the age of 80. All of these patients, when someone contracts COVID, even if it's a milder variant, we also get a lot of calls from people who are panicking. Should we rush them to the hospital? We've even seen with the Bollywood fraternity, right? A lot of people are rushed into the hospital the minute, even if they are asymptomatic or they test positive. So, one, how can we as a community differentiate who needs to be in the hospital if they are high risk, who can be managed at home? And I feel nurses are the ones who can bridge that gap, right? Even if some extra care is needed, both between hospital and home, that's a big way in which the burden on the healthcare community can be reduced.
No, definitely, I'm very much thankful to the nursing fraternity that they have come up and they have really taken up the load of the hospital, and they have created atmosphere within the proximity of the home. Yes, definitely, care for a COVID positive patient at home requires a certain kind of training, certain kind of understanding, and certain kind of medical management that has to be totally aligned as per the advice of the doctor. But yes, this nursing community has really taken a very much load on their own shoulders to manage these things throughout the world, and creating a safe and healthy atmosphere within the proximity of patients' home, so that they also feel, yes, they are getting a right amount of care as per the medical advice by the doctors or by the medical fraternity, and things are being managed in a very well medical manner within the home. If I say yes, we as a so many patient across country, those who were positive from the COVID, but with the right counseling and right amount of medical education to them, they decided not to go to the hospital. And yes, depending on the nature of their medical issues, most of them were really potentially fit to be taken care at home. The nurses in this home healthcare segment has done a very wonderful job keeping the things within the normal limits, keeping the hospital available for really a potential patient, those who cannot be managed at home. And yes, the right amount of care that has to be given, be it by the means of medication, be it by the means of oxygen therapy, be it by the means of keeping their morale high and providing the right amount of care at the right time, so that they should not get panic. Their family should remain cool and calm. And while they have a positive patient in the home, how rest of the family member has to stay within the same home, maintaining safe isolation for the patient and rest of the family member. So the home health care and especially the home health care nurses has done really, really wonderful job keeping this peace and the keeping the kind of panic it was during, especially during the second wave, and managing the patient in well medical manner. And if we say yes, there are a patient, those who has a potential risk, or those who are really at a potential high risk of having a patient, especially for the elderly group, especially with the comorbid conditions like diabetes, hypertension, asthma, or they may have some kidney disorder, they may have some liver disorder, they may be on dialysis, they may have some uh, major surgeries done in the recent past, or they may be a potential case for an organ transplant surgery. These patients are always at a very, very high risk, so that the monitoring of these patients has to be very, very close. Any point of time, if they feel like, yes, if there is a marked fluctuation in their medical parameters, vital parameters, proper medical guidance has to be sought immediately. Definitely, if you cannot provide the right guidance at the maximum level things possible proximity, but yes, at any point of time, if a healthcare professional at home feel like, yes, this potential patient whose sugars are not managed well in home, their bp or their hemodynamics are not well controlled, or their oxygen requirements are going way beyond which cannot be managed at home, those kind of patient has to be shifted to the hospital. Otherwise, most of the things, if done in the right manner as per the medical advice of a registered practitioner, things can be managed at home. There is no need to be panic about, because that will not solve the problem. Ultimately, one has to face the thing and one has to deal with the things in the right manner. If you have right advice, if you have right set of people available at home, be it in the form of a professional nurse or a caregiver, or be it a family member, those who understand what has to be done and what time it is to raise alarm, things can be easily managed at home. And there is no need to panic about, no need to rush to the hospital. People may have certain liberties. Yes, they might get a bed easily in the hospital. They may have a health insurance so that they do not have to put a burden on their pocket. But we need to understand the hospital care, we make sure that is available for the needy patient. I may have a health insurance, I may have connects to get a bed easily in the hospital, but I should not take those liberties so that I can block a road for a potential patient, those who is much needy than me. We should always contribute to the society, and we should always evaluate ourselves what exactly we are contributing to the society. Are we really taking our own responsibility in the right direction? Are we not misusing our rights and responsibility as a citizen, responsible citizen? Or are we helping society in some manner, or offering the help first to the needy patients, which are more potential for the care, more potential for the hospital admission?
There is a question that's come in. What is your opinion on the COVID-19 vaccination for lactating mothers and pregnant women? That is a question that's come in the chat box.
So as per the WHO guidelines, as per the guidelines of Ministry of Health, it is totally acceptable. Yes, a a person who a baby in near future, or a lady who has recently delivered having an infant baby, they can easily get this vaccination. There is no adverse event noted so far for any such patients after vaccination. And yes, initially it was not recommended, but over the period, the research said that it's safe for a pregnant lady or a lady who's recently delivered a baby. So vaccination can be given to those potential female candidates. It is safe, it is advisable, and most of the time the doctors are encouraging yes to get the vaccination right at the right time.
Any of my co-hosts want to ask questions before Aishi ma'am?
Yes, ma'am. I would like to welcome again Dr. Sanjay Vajpayee ji. I just want to know that how to differentiate the Omicron and the Delta virus, and what are the symptoms that we are seeing in the patients.
That is still under research, ma'am. Differentiation between Omicron and Delta is not easily, because the kind of investigation available to identify COVID positive or negative is still the same. But yes, research are going on. The kind of patients that are being admitted at the hospital, their genotype, their RNA type are being evaluated over the period. And yes, as you said, what are the differentiating factor? As such, there is nothing like that. Every patient, those who may have a simple viral fever, they will also have a fever, running nose, body ache, cough and cold, sore throat kind of thing. And Omicron or Delta, they all have symptoms in common. But yes, as
Yes.
per the new guidelines, the certain changes has been made into the isolation part, the treatment part. We have seen some kind of advanced management during the Delta wave, but because the severity of the illness was very much over there, the Delta virus was very much potential affecting a patient's respiratory system, which has not been observed so far in the Omicron. It has been observed that it remains within the upper respiratory tract, and it does not necessarily or very rapidly affects the lower respiratory part of the respiratory system. Hence, the severity and the complications of this Omicron is little less. But at the same time, the spread speed of this virus is almost triple to the Delta virus. So you may be knowing each and every day over the news, over the newspaper, that the count of the patient increasing day by day is very fast in comparison to the previous wave. But yes, the severity is a little lesser, although yes, people are getting more positive during this time. Even a person who's having a simple cold and cough, a little bit of sore throat, and those who has come across or exposed to a potential positive patient, they are finding to be a positive patient. But as far as absolute differentiating factor, there is no such criteria has been established till now, because still the things are under evaluation over the genotype of this Omicron virus.
Doctor, so I know the guidelines have changed. Would you like to walk everyone through the how many days? The ministry's been saying that once your fever is over, then after 3 days you can end your isolation. There's a lot of earlier we were
Yes.
saying first we
So
started with 17 days, then we went to 14 days. So what is it that people should be following? Till when is a person considered contagious?
basically, the guidelines for home in the previous Delta wave was for 2 weeks, 14 days. So once you have a positive report, then your isolation period starts. Although you may have symptom a day or 2 day or a couple days prior to that, but the
Right.
exact timeline starts once your reports come positive to that. But this time, when we are expecting more and more cases affected from Omicron virus, the guideline says almost the same, but the duration of this isolation period has been reduced to 7 days. And during those 7 days, if you find there is no fever for last 3 days, then only you are a potential patient to end your isolation period. Otherwise, it has to be at least 72 hours of without fever uh, number of days. So total 7 days, in which out of 7 days, at least last 3 days of your health not have any spike of the fever.
So if someone was to test, if someone was to develop a fever, then they would need to wait another 72 hours, and that 7 days is not applied.
Yes. So since the last spike of the fever, they have to wait for at least 3 days before they call it off the isolation.
Yeah, because we get a lot of queries and a lot of people, we run a free OPD as well. So even in that, patients come and ask, right? They say that, oh, we had fever, day before yesterday, but today we feel completely fine. Our cold is gone, and they assume that they don't have
No, no,
COVID-19,
no,
even
look,
though that they have symptoms. Plus, a lot of people may
no, no,
not test in the first
that
go.
is that is
So, yeah,
that is the main uh, issue that we have to deal with.
yeah, yeah.
People here, or may say, I would say, in a developing countries have their own criteria developed very soon.
Hmm, hmm,
They have their own doctor, they becomes their own treating doctor, and they have their own criteria of their own treatment.
yeah.
Until unless things go beyond their limitation and they really became panic. So we should always avoid these things. If we know, yes, the society is under the threat of a viral infection that is growing rapidly, that is moving fast ahead, any symptom, I say any symptom, be it a low grade fever, be it a sore throat, be it a gentle cough, or any exposure to a potential patient where they come to know that the X number of patient I met yesterday found to be positive. Ideally, they should get checked. There is no harm getting yourself tested. That will definitely keep you safe, keep your family safe, and keep your society safe. If you do not get tested yourself, you will never come to know what is the virus. And until unless it's been or documented, you will definitely not follow the norms of this isolation or this COVID protocol. So my sincere request to each and everyone, whosoever is listening to me, if they have any potential symptom of this COVID illness, or if they have came across any person who found to be positive in a later stage, please get yourself tested. There is no harm. The test is so simple that you do not have to go through a long procedure. But yes, definitely it will help you, your family, and the society for keeping these things under control.
Dr. Pajpai, what about the people who may test negative first? And this has happened in a lot of cases. Someone tested negative, say one day, on a Tuesday, but then tested negative, positive 3 days later or 2 days later. How does that work? And also, there's a lot of conversation around home tests. So these self home tests. So a lot of people may have a cough and then they do a home test, realize that they're negative, and then move on. So that's also causing a spread of the infection. So how do you determine when to test, whether the test is accurate, and what kind of test to do?
There are so many testing kits available. There is so many methodology available. There are rapid antigen tests. There are self-monitoring tests, which people are trying to implement and trying to make a decision out of this. But as far as my advice is, if you have any symptom, or if you have come across or any individual who found to be positive, or if you are observing there is even a single mild symptom that is common in nature of COVID, even if your initial testing at home by self procedure found to be negative, do not take it lightly. A simple cough which settles in a day or two, a simple cold or simple fever which settles in a day or two, does not always means you are negative. Even the rapid antigen test sometimes found to be negative, but later on when it comes to RT-PCR, they are found to be positive. So always monitor yourself, try to isolate yourself if you have any potential symptom which is common in nature of COVID-19, and get yourself tested accurately. Sometimes the initial test may come negative, but still you have to maintain the isolation, you have to maintain the COVID protocols, you have to maintain all the uh, norms that has been advised by the government of India or WHO. And yes, sometimes there may be a need of second test, maybe a couple of days later if you have continuity of those symptoms or you're not relieving with the primary symptom. And there is no harm if your initial came negative and came positive. It is always safe to have a proper testing of yourself. That is why the government is also putting their stress upon testing, tracing, and treatment. So until unless one gets tested, they cannot be traced, they cannot be treated. So the thing starts with testing. So please encourage yourself, your family members, or your society members, those who have any potential symptom, they should get tested. The ideal test for COVID positive or negative nowadays is RT-PCR. Rest all of the cases may have certain uh, false negative or false positive kind of finding. But yes, your nasal throat or oropharyngeal throat swab that has to be come by the means of RT-PCR is the only authentic report that you have to rely upon.
Dr. She's asking, is a person, if a person does not have fever for 72 hours but has persistent cough and cold, then are they still contagious?
Definitely. Most of the time, you're. So yes, we have seen so many cases, and the variety of cases that we came across, patient might not have even a single symptom. Forget about cough, forget about fever, forget about body pain or any other issue. They don't even have any symptom, but still they are found to be positive. Don't know how, if they have become exposed whenever they go to market to buy the grocery, or somebody standing nearby has spread the infection. But yes, any symptom which is being listed as a potential symptom for COVID-19, even in a mild form or a moderate form, there is always recommendation of testing yourself. Doesn't wait for things to worse first and then test it upon. Please take a step forward, evaluate yourself, test yourself, and that is the only thing that we can do to save ourselves, save our family, and save our society. The more we emphasize upon testing, the more we have a safer atmosphere. The more we ignore the testing, we might spread it rapidly.
But what if a person is positive, they have finished their 7 days in quarantine, they don't have fever, but their cough continues, which is happening in a lot of long COVID
Ye-
cases also. So how do you differentiate
Yes.
if a person is contagious?
No, look, the clinical symptoms may persist for a longer, even more than 7 days, 10 days, depending on the severity of their own immunity, depending on the kind of medication they have taken through, and depending on the nature of other comorbid conditions that they might be having.
Hmm.
But as far as this Omicron has concerned, they have a peak spread within the proximity of 7 days only.
Hmm.
Post 7 days isolation, if a patient still have some mild fever, if they have a little cough, their isolation can be stopped, but they will also advise to wear the mask. They also advise to stay within the home, and they also advise to continue the medication till they have a complete recovery. So a
Sure.
person who has already completed 7 days for isolation, but still having some symptoms in some form, definitely they are not advised to go out for their routine work or routine duties. They has to stay within the home. Yes, their isolation may be ended. They are not so contagious to spread the disease to the near proximity, but yes, their complete recovery is the primary thing that they should focus upon. And once they have a complete recovery, be it in the form of fever, be it in the form of cough or any other symptom, then only they should think about going out for any reason. But still, yes, even if they have recovered, even they have completed the isolation period, there is always a risk of reinfection. So they are they have to take the proper precaution and follow the COVID norms wherever they go, or even if they stay at their home only.
Ms. Rohini Sharma is asking, do fully vaccinated people suffering from COVID now require the booster dose? And if yes, when should they get a booster dose? If they're fully vaccinated, or have been tested positive for COVID with Omicron.
So many of the European countries has already started this booster vaccination. Recently, we have introduced the booster vaccination. So, like we started our vaccination during the initial phase for the potential risk patient and for the frontliner. Yes, these are already started from 10th of the January. So the frontliners, the elderly people, and the potential risk patient, those who have already received 2 doses of vaccination and they have completed at least 9 months of the second dose. So if a person has taken the second dose in the month of April 2021, so their 9 month completes in January 2022. So from February 22, they can go for a booster dose. And yes, it is safe to have a booster dose. And as per the study shows, the maximum immunity level that our Covishield or Covaxin gives, that is for within 9 months. If they have completed the 9 months of their second dose, they can go for a booster dose. But for now, the vaccination has started only for the frontliners and the patient those who are at potential risk, like elderly patient or immunocompromised patient. And over the period, as we progress, definitely it will come down to the line for rest of the population.
Thank you. Marilyn, ma'am, do you have any questions before I move on to the rest of the?
Yes, but actually, Sir Rohini has asked if the person is infected now after taking both the fully vaccinated, but currently the person is infected. Now, means even after 9 months, for example, I'm due for my booster, but now I'm infected with COVID-19. So when I'm supposed to take my booster?
So within the period of 9 months from your second dose to your booster dose, even if you found to be positive for your COVID in the new wave, still advise, yes, if you have completed your 9 months of the second dose, you can go for a booster dose.
So the
After
government earlier was recommending a 3 month gap if you get COVID-19 during the Delta wave. Does that still exist? I think during the Delta wave, if you were COVID
Y-
positive, you were to get a vaccine
Yes,
months later.
yes. For those patients who was found to be positive during the Delta wave, they have been advised for at least 3 months once they recover from the thing, because it has been observed, yes, they have developed the immunity level which will remain within the body, and the chances of getting reinfection is quite nominal. But yes, over the period, every now and then we are going through some studies, we are going through some research. So as per the recent guidelines, those who has completed the 9 months of their second dose, they can go for the booster, even if they found to be positive for any new variant during that period.
Sir, I have one more question. There is no, there is an expensive medicine like antibody cocktail, and it
Yes.
has been stated that it reduces 70%. It reduces the hospitalization, and everyone will not be able to afford for that. So, what is your opinion about antibody cocktail?
So basically, antibody, this monoclonal antibody is a mixture of certain drugs which definitely increase the immunity of the patient suffering from COVID-19. There is a criteria upon which the patient has to be evaluated and found, yes, if they are potential for that cocktail therapy or not. Definitely, it's an expensive thing and not very common, especially in a tier 2 cities or small nursing homes or hospitals. Recently started available on a selected hospital. Selected doctors are started practicing, but it has shown a very good result. So the criteria, yes, the patient, if the patient has age of more than 65 years, if they have comorbid condition, and this vaccine, cocktail has to be given within the 72 hours once they come to know they are found to be positive, not after the 7 days. So there is a definite criteria for those patients who should receive. There is a set timeline upon which this cocktail has to be given. And yes, for as of now, it is strictly given under a medical supervision within the hospital, not available for open home healthcare scenarios, because still things are going under research or evaluation, whether what kind of side effect this drug may have, what kind of adverse reaction these patients may have, and what kind of complication, even if the things goes in a little wrong direction, what are the things that need to be taken care, so that a complete medical monitoring within the hospital under medical supervision, this has been started. But yes, the quantity and the quantum of these therapies are very less in view of the expenses of this medicine.
Thank you, sir. Thank you so much.
Madhumata ma'am, do you have any questions?
Um, no, ma'am. Actually, what I am thinking, sir, already clear that precautionary dose. I was asking that at what time or the period we have, or is it compulsory to everyone to take precautionary dose after second dose of vaccine? So, sir has already cleared the many doubts, and sir has taken so much
We should not
nicely. He
make
is
government to make the things compulsory. It should come from ourselves. What is right, what is not right.
yeah.
Still, there is a larger population those who doesn't feel yes vaccination is right. They might have some complication. There may be some after effect, but I have never seen any patient except for a day or two of fever or some body ache. Otherwise, there is no adverse reaction noted or any mortality happened because of this vaccination. So I strongly recommend each and every, even the government has started vaccination for the lower age group of people from 15 to 18. So we should always encourage people to go for vaccination. It is always a safe option, and it will definitely increase the amount of immunity in their own body. Although if they have COVID status in the past, it is always advisable to get a vaccination. And yes, over the period, those whosoever are potential for the booster dose, they should go for it.
Oh, thank you, sir.
Mrs. Sunil is asking, what about shopping for groceries and buying products? Because obviously those are places where everyone is visiting. Some people may be unwell. You don't know who's visited before. So is there some sort of guidelines into when it comes to objects and food items and stuff, and how COVID can get transmitted, especially this new variant?
No, it's always safe to be a little more vigilant whenever you are going out of your house to buy some grocery or any amount of work which you feel like has to be done and you have to go out of the house. You have to protect yourself, and whatever you are buying, that has to be washed, that has to be cleaned properly, so that you can reduce the amount of infection that is bringing within your home from outside. And as such, you cannot see the virus, you cannot predict yes this is a potential risk or this is safe, but safe practice always need to be adopted. If you are going out, you should have proper mask, you should have covered your body, you should have taken proper sanitization. You are using, you are washing your hand, and whatever you are bringing from the market to the house, first it has to be cleaned by a running water. Everything cannot be washed with a soap or detergent, especially for the vegetables and food items. But yes, even if you are going out of the out of your house, whenever you comes back, you have to change your clothes, you have to wash your hands and feet and face wherever possible, and always try to keep the things clean and disinfected, whatever you are bringing to your house. Do not go to any such shops where there are so many people in the queue or line, or if there is overcrowded shop. Wait for your turn, because if you remain safe, things will not affect you and your family. So the safety first precaution has to be adopted. The disinfection process has to be adopted. That is why we are saying we have to use the sanitizer. We have to wash our hands every now and then. How to make the things which should not bring from outside to inside the house. We should create a kind of barrier. Even it is always advisable one dedicated person from the family should hold the responsibility of going out, not all the family members, so that at least you should have idea whosoever is going out for any reason, they should have some kind of distance with other family members, and they should practice the safe things, how to go out, and whenever they are coming back, how to make the things clean for rest of the family members.
There is just one last question which is left before we conclude this session, and I ask my co-host to give the vote of thanks. Do any of the viruses or vaccines affect the menstrual cycle for women? I mean, the question is that there are a lot of myths around all of these, and what are the facts? That's what they're asking.
So yes, as I said, there are so many myths happening, and people still not coming out of those myths. So from the best of my knowledge, there is no effect on the menstrual cycle post vaccination. There is no effect on your personal hygiene or personal
We can hear you, Dr. Sanjay.
so we have not seen any case where people has come across to us and said, yes, I have taken the vaccination, and I believe yes, this medical complication has been because of the vaccination. This vaccination program that government of India is running door to door, encouraging each and every people to get vaccinated, is one of the safest things to have. And this is really helpful to fight against COVID to a certain extent. But yes, keeping yourself, following the protocols, the norms which has been laid to protect you and your family, that always need to be practiced across along with medication and this vaccination. So please encourage people to get vaccinated if they have any.
Dr. Sanjay, you're on mute. Yeah.
Follow the right guidelines. Even if you have mobile phone, you can go through. There is no such cases reported which has after effects of the vaccination, and so don't believe on those myths.
Thank you, Dr. Sanjay. I'm going to ask Ms. Aishi Bansal, Professor, LLRM, Medical College, Meerut. Aishi ma'am, if you can please give the vote of thanks and give the conclusion for the session. Over to you, ma'am.
First, I would like to thank Dr. Sanjay Bajpayee for such a nice explanation, and the way of answering is very, very nice, sir, and very understandable. I hope each and everyone in this live session have a great sort of praise for you, sir. And in even chat box, we can see that there are so much praises for you and your explanation and your explanations, sir. I would like to thank Dr. Sanjay Bajpayee again for their motivational and such nice piece of explanations, and Ms. Naina Agarwal Ahuja, Trustee, Heart Care Foundations of India, and Mrs. D. Marilyn Frincy, Principal, Apollo School of Nursing, Indraprasth Apollo Hospital, and my co-host, Mrs. Madhumita Toshin, Assistant Professor, Institute of Nursing, Bhopal, Rabindranath Tagore, University Institute of Nursing, Bhopal, Madhya Pradesh. Myself, Ayushi. I am from College of Nursing, LLRM Medical College, Meerut. I would like to thank all the participants, all the health professionals and students who are participating and questioning in chat box very enthusiastically and listening very patiently. And I would like to thank everyone for their time and patient listening again. And I would like to request everyone now to leave the session and hoping for joining the next session also. Thank you so much, everyone.
Thank you, ma'am. Thank you so much, everyone. We will continue these
Thank
sessions
you.
every few weeks.
Thank you.